Well, thank you all, and I also want to thank the organizers of this event to get such a broad group of minds together across various disciplines, because it is going to take all of us to solve this. I was hoping that there would be individuals from the human health care sector here. I'm told that there are not, but if I'm wrong, is there? Yes. Awesome. Okay. So it is, as a veterinarian, and I suspect as human health care, we're in kind of a sticky wicket in that our patients need the medications or the items in many cases in which you're finding in the analysis. So whether it's prescription selection, understanding the pathogen that we're fighting, or other alternatives so that medications may not need to be necessary or necessary as long, I think that that would be welcomed information by both human and veterinary sectors. So I also want to give a plug because the last speaker did mention disposal, and you can do that in your local community, but the DEA is also offering the National Take Back Day, April 30th, and you can check their website for a local site near you. And whether it's controlled substances or non-controlled, they are collecting them all day, and it's amazing how much that they do pick up. So I definitely wanted to give that a plug. Hope you're going to utilize that if you have, especially, we heard one from, 1967 or 63? So the pharmaceutical disposal challenges that we face, you guys have talked about many of these already, and you're aware of most of them. Where the veterinarians have it seems like an impact, or where our focus might be, is that the bottom two is the issue that when we're talking to our clients or we're talking to other veterinarians or regulators, we're competing for their time and attention when so many other items are also competing for the same amount. So sometimes it just doesn't register with them, or then we get into the bottom bullet where there either is confusion, and confusion arises because, as we've already acknowledged, the problem is there, but we don't know how to mitigate it yet. We need to use the drugs, but we don't. Everybody pees, everybody poops. So there we go. Then how do we get that out of the system once that it's there? Or if we're trying to protect ourselves from sunburn, or we've got flea and tick control on our dogs or cats, and then they get the bath, or then they go swimming. So there's all kinds of contributors to this. Then the bottom bullet, like I said, I can understand the confused or the uninformed. It's very frustrating in the veterinary community when we come across somebody who just doesn't care. So then one of our jobs is to help them to understand why it's important to care. And when we convey that to them as a human, and then drinking everybody else's medications or disinfectants, then it starts to register. So the impact that veterinarians can have, you see up there a basic list of from the 2012 source book on demographics on the basics of animal owning households, number of dogs, number of cats, and birds and horses. These are more the companion animals. So with them, and even if in 2012 we were having visits per household per year, is around 6 million. So that's potentially 6 million opportunities where we can help remind the animal owners of the need to dispose of these properly, but the best need not to have to dispose of them is to give the medications through their complete prescriptions, to store them properly. If they're stored properly, then they will be useful longer. Like a typical one might be Clavamox. In the human realm, it's basically a cousin to Augmentin. But not as strong. But if it's mixed with water, and it's supposed to stay refrigerated, but if it does not stay refrigerated and they left it in the car after they left the veterinary clinic, its effectiveness drops dramatically, and then they need to dispose of that and come back in and get another one. So, or then worst case scenario, drug was not stored properly, a child gets into the drug, or an animal gets into the drug, and then you might have a fatality. So we stress that to them, and then that helps with the storage issue. What's not on here are some of the production animals. The AVMA has been advocating for years that veterinarians have greater oversight in the use of antimicrobials and other medications, used in production animals and animals in general. What you might not be aware of is the FDA has passed its final rule for the veterinary feed directive, so the medications that are in animal feeds, where at one time some of them were over the counter, they are going to be no longer over the counter, and it is also illegal to use veterinary feed directives off-label. So it can only be used as the directive states. The directive is similar to a prescription, but not quite a prescription. It has to be on a veterinarian's order and is made up specifically for a facility. So that's a win, and it's a start of involving the veterinarians more in the medications that are provided to the owners. You can still go to pet stores, farm stores, and see over-the-counter medications, just as you can go to any human pharmacy or, I almost said a chain store, so you can imagine which chain store I was going to say. And there's medications that you can get over the counter. So both in human and animals, that's a common ground item that both in the veterinary field, the animal owner education is needed, and in the human health care, the individual client education is needed. Because not everything is going to get better with a drug. But I fear that society's perception is that a drug is needed for you to get better. And if a drug's not there, you're not going to get better. Or why do you even go to the doctor or the veterinarian if they're not going to give you a drug? But antibiotics don't do anything against the virus. They can help protect against a secondary infection. But sometimes we need to allow our own immune system to tackle the item. So for pharmaceutical disposal, our client education, one of the main mantras is do not flush. And the AVMA partnered with the Illinois Indiana Sea Grant, actually the National Sea Grant Office represented by the Illinois Indiana Sea Grant. And we have a memorandum of understanding with them, and part of that is messaging to animal owners as a potential to reach people on a daily basis through our membership. So like I said, our key message is don't flush. Well, if you can't flush, because some of the agencies were telling you to flush, so anybody from DEA? All right. So part of the DEA anti-diversion, because if any trace is left in a bottle or there's pills listed on there, and anybody know what skittling is? Yeah, that's sad, isn't it? Somebody does know, and people are going to start dying from that if they're not already. Basically, okay, for the rest of you guys, basically, people, how should I say this? Some folks will raid other folks' medicine cabinets, put all the pills in a bowl. You have a party and you grab a handful of pills, and then you pop the pills, and then you have a chemical experiment in your body. So that's, what can I say? I guess that was bad enough. I shouldn't have even gone there. But that also goes to the store properly, which is the second part. Follow prescription labels, which we said to begin with. So if a doctor prescribes a human medication for so many days at so many times, I've been in a car accident. I know this is a really good pain med. I might need it later, and I'll save it. And I've done that. But I also need to be aware of then that medicine cabinet could be a risky situation if someone chooses, one of my guests chooses to come in and skittle. Or, if it was stored in a different place, then dogs or cats could get into it. Then I put in there to follow the disposal instructions. Your veterinarian will often tell you, well, if you complete the medication, there's nothing to dispose of. Your animal is already doing that through its feces and urine. But if you do have to dispose of, at least now with changing regulations, a lot of the pharmacies have take-back drop boxes at their facilities, and also law enforcement does too. So those are always clear options. And then there's the National Take-Back Day that is on the 30th. If you don't have a disposal option in your community and you'd like to start one up, the Illinois Indiana Sea Grant's webpage has a means for you to do that. It has resources and has information for you to get that started in your area. So with the veterinarians, you saw an approximate of the number of companion animal owning public. Our membership with the American Veterinary Medical Association has 88,000 members, well, 88,200 and some odd, that can basically then be spokesmen for proper disposal once we get the right information to give to the people. There's gaps that we don't know. We are reliant on the knowledge of individuals such as yourselves to find out what is the fate and transport of this drug. And if another drug becomes completely inactivated with, I don't know, let's say it's as simple as ultraviolet light for a day and a half, you know, or something like that, or a change in pH. So if we have two drugs equally effective, one is inactivated or broken down by a much simpler means than the other one, I think that science would take over. Pharmacy companies might have a battle to go out with, but with educational outreach that we could give our members, and I'm sure that the human health care would want to give theirs, that we can make a difference. We just don't have the information to make that difference yet. So we're very reliant on you guys to help point us in the right direction. With the members right now, some of the things that we do are inventory control, because if we get fewer drugs in, fewer drugs are going to expire and fewer drugs will need to be disposed of. So that also then sends a message to the drug makers: we are not ordering as much, please don't make as much. So hopefully that's going to make a difference. We'll also rotate stock. As items become short dated, you can often return items to the manufacturer and they will replace that with a longer dated item. And then reverse distribution. So basically, even if you have expired drugs, is there a broker in your area or that you can contract with to send that drug for them to dispose of in a more environmentally friendly means versus the veterinarian disposing of in the garbage, or if it's a controlled drug, through a special agent in charge with the DEA or other means like that. The AVMA has asked folks not to just dispose of in kitty litter or coffee grounds, as was mentioned earlier. Yes, it's a deterrent for animals and humans to a lesser extent, depending on what the drug is, but it doesn't solve the problem. So we are trying to use the brokers and get it into a more controlled disposal stream, all pun intended, versus dumping it into our local stream. Then there's also training and compliance, not only with controlled substances, which have a plethora of their own items, but also with drugs that are considered hazardous, whether they're hazardous according to EPA. So if they're flammable, like Ivomec is flammable, Porons. So you've seen flea control products, wool and cattle. There's also, lice control and other things you can pour on their back. Well, some of those items are flammable. If the items are corrosive, some of our lab reagents are corrosive, or disinfectants could be corrosive. So there's special training that's need to handle those items and then to document that. Then also to train the employees on what to explain to the owners when they are dispensed a medication or prescribed a medication. So if there are any animal owners out here in the general public and you don't get directions from your veterinarian or even from your doctor when you receive a prescription, then ask them, ask your pharmacist, whoever you're getting the medication from. They will probably say you shouldn't have any left over. You can say, well, just by chance, how do I? And hopefully, if it's a pharmacy, they'll have a drop box in their area and they can just point to that. And then veterinarians also do waste segregation, which I suspect that the human healthcare also does. So you might not be able to see it up there, but those are some of the drug types that we've been talking about. So all the pharmaceutical waste can be broken into, is it a controlled substance? Is it a hazardous pharmaceutical like some of the cancer treatments that we have? Is it radiologic, such as some of the radioactive iodine for treating cats with thyroid cancer, things like that. And then we also have mixed waste. So if it's a combination of those, then is there a broker that is in your area that you can contract with to take each of these? Or if they can't take each of them, is there only one that they can take? So you might need 2 or more waste brokers to handle the waste that your particular facility is generating. So this is just the AVMA's policy, or the best management practices for pharmaceutical disposal. And the previous slide and what I've talked about already basically summarizes this, but if you're curious to what the AVMA's policy actually is, then that's up on the screen for you, but also available on the internet. But we're just asking, ultimately, it used to be a very long, very prescriptive, bullet-pointed item on do this, then this, then this, then this. Across states, regulations vary, and as new information, such as we're getting from you guys all the time, and we hope to get more information, what we need to do actually changes. So we soften the language to back off, instead of being so prescriptive, to have more of a performance standard, so that folks are aware of changing regulations, changing options, disposal in their area. Not to flush, not to burn, unless you're specifically permitted by a regulatory body, which is not going to happen. But to that little statement was because if AVMA says do not do this, our lawyers have said, if you say do not do this, then you might create liability for your members. So that's why we added the unless directed by an authority. So anyhow, and segregate waste, train your employees, and I think that like I said, the veterinary world and then also the human health care world, we have a common ground in that the problem exists. Problem exists both in humans and in animals. What can we do to help mitigate it on our end as much as possible with the information that folks like you guys are giving us, with regulations that the authorities have, and are the regulations lagging so far behind the time that with the information you're giving, can we help, can AVMA or can the human health care sector help get some of those regulations changed? So please utilize us as you can, keep us informed, and we're just very happy to be part of the conversation. Some of our key items that we do are the advocacy, and our targets are the animal owners, veterinarians, and then regulators and policymakers, basically what we talked about. But again, we're very glad to be part of this conversation, reaching across disciplines, because I think that such a cross-sector is going to be needed to help mitigate this wherever we can. And I'm very hopeful that we'll be able to make a difference on some of these substances. And I also recognize that, perhaps we can't make a difference, and perhaps there's going to be alternatives, so we don't have to use that compound that we're not making a difference on anymore. I don't know what the future's going to hold. I already mentioned that we have an MOU with the Illinois-Indiana Sea Grant. We also provide information online through blogs and items. But as I mentioned just a few minutes ago, if you have information and you need regulators swayed somehow, if AVMA can be of use to the effort, please don't hesitate to reach out to us, to share the information that you have, to share something that, even if we've been doing something for decades and then new studies show that actually this is a problem, this is how you can fix it. We need to know that too. So please let us know. And then we have also a group in our GRD office, also works on the Hill and can influence legislators. So there's also that capability too. So my contact information is projected on the screen, or you can also find it at avma.org. Like I said, I am tickled to be part of the conversation, and I'm glad that there's such a breadth of knowledge and interests in the room. So if you have any questions, I'd love to try to answer them for you.
Do you want to stay up? We can have time for a few questions.
I didn't see any hands shoot up, so I was out of here. No, sorry.
Does anyone have a question? I have one, and then I'll go to you.
Dr. Clapper showed the example of metformin that didn't act in the environment as the pharmaceutical company had predicted. Is that correct? What is the state of environmental fate studies by the pharmaceutical companies?
what is the state of them? Well, obviously from that, I would take that it didn't cover what's happening. I mean, that's beyond my realm. I don't work with the pharmaceutical company, so I don't know. But as the earlier speaker said, the information based on the item, the use for the indication or use for which they sought approval was based on a certain study, but the new uses are not reflected or not being the same. So it's deviating from that. I'm not involved in that, so sorry I can't answer.
Are they getting it? Are they getting the message? Are we putting any pressure on them to design these pharmaceuticals that they're not persistent, that they do degrade more rapidly in the environment?
Oh, I see.
Or do we need new regulation to address that issue?
I would suspect, but I would defer to the previous speaker, because AVMA has not been asked for that, and before this conference, I was not aware of that particular. So AVMA has not advocated for that. We have advocated for approval processes to be transparent and complete, but we weren't aware of that other situation. So perhaps the previous speaker may. I don't know.
Well, I'm not talking about that particular, but in general, it seems like there needs to be more transparency, and greater access to those testing by the pharmaceutical companies.
Any other questions? Then I did have one on, you mentioned one of the objectives for AVMA is to have education of the patients, and that, do you have any information about what percentage perhaps of veterinarians actually talk to patients about that? Because I know when I go to the vet, they never seem to mention what to do with the medicine later on.
Right, we haven't done AVMA hasn't done a study on that, but I'm thinking, and I am the worst person with names, and I apologize about that, and she's not here. But I thought that there was a gentleman from Washington who had done a study with veterinarians. I mean, it's a very local study to ask questions like that. And it is not coming to mind. What I will do is I will find that information and send it back to you and Laura and to share with the group.
Okay,
But sorry, I don't have the answer for that.
okay, that's fine. Thank you. Okay, thanks very
Oh,
much.
thanks.